Since the last national briefing on the 26th of April 2021, the Presidential Steering Committee has also received the expression of genuine concerns by experts, international organizations, the African CDC, Nigerians, and other friendly nations over these developments. It has also, on the merit, assessed the situation in Europe, Asia, Latin America, and the USA with a view to preventing importation of the variants of concern. The surge and the virulence of the variants of concern has resulted in the deaths of hundreds of thousands of persons in India and a number of countries, and has unfortunately disrupted the production of and global delivery programs for vaccines. These developments certainly underscore the fact that indeed no one can be safe until everyone is safe. On behalf of the government and the people of Nigeria, the Presidential Steering Committee wishes to express deep sympathies and condolences to these nations that have been badly affected by the new surge, and pray that the Almighty should bring relief and total halt to the ravaging effect on humanity. The Presidential Steering Committee calls on all nations of goodwill to continue the good work of supporting nations that are encountering the turbulence at this time. As you are all aware, the Presidential Steering Committee has already issued a travel advisory which took into consideration the utility of travel restrictions, outcomes of epidemiological risk assessment, factors that aid transmission, as well as control measures that could be deployed. In the advisory, additional requirements were placed on passengers from India, Turkey, and Brazil. The Director General, Nigeria Center for Disease Control, will elaborate on this during the briefing. The Presidential Steering Committee has received reports of some returning foreign passengers who violated the mandatory quarantine requirement under the advisory by escaping from the facilities. We deprecate such violation of the laws of our land and our hospitality. The Presidential Steering Committee is awaiting the report of ongoing investigations, and we wish to assure Nigerians that appropriate sanctions will be imposed on the violators. The Presidential Steering Committee has also considered several preemptive measures to be taken to mitigate the likely impact of variants of concern should they get imported into Nigeria. This step has become compelling in view of the fragile state of our health systems, the disruption of vaccines delivery, and the lack of compliance with the extant public health measures and social measures contained in the coronavirus disease COVID-19 Health Protection Regulations 2021. The Presidential Steering Committee has therefore considered it imperative to reinstitute the various public health measures that were put in place under the Health Protection Regulations. In taking this step, the Presidential Steering Committee requests the state governments to please step up to play lead roles in the area of enforcement and sanctions. Similarly, our appeal goes to traditional, religious, and community leaders to take up more ownership and responsibility for risk communication and community engagement on the virulent nature of the pandemic, concerns over variants of concern, and the need for compliance. The technical head of the Technical Secretariat will elaborate on the reinstituted or guidelines that were in place, but for the purposes of emphasis, we want to restate those guidelines because that's about our best defense line as of now. Closely associated with the control measures is the issue of vaccine access and administration. Given the challenge of vaccine nationalism, compounded by the production situation in India, the Presidential Steering Committee is exploring other options to get Nigerians vaccinated. As at date, 1,690,719 persons have received their first dose of the vaccine in Nigeria, representing 84% of the targeted persons for this phase. We appeal to states, especially those high-burden areas, to push ahead with vaccination program. The Honorable Minister of Health and the Executive Director of Primary Health Care Development Agency would elaborate on this. Accordingly, the Presidential Steering Committee has produced a new implementation guidelines being phase 4 of eased restrictions of COVID-19 lockdown or restrictions in the country. The head of the Technical Secretariat, like I said, will brief you on details of this new guideline. The authority of ECOWAS heads of state and government has fixed the cost of COVID-19 testing, whether PCR or any other form of testing, antigen testing, at $50 at all points of entry with effect from 17th May 2021. This is to ease travel and trade among citizens of ECOWAS states traveling within the region. This amount is only restricted to tests for ECOWAS citizens or people carrying ECOWAS traveling documents, and it is also only restricted to travels within the ECOWAS sub-region. Before I invite the Honorable Minister of Health, the DG, NCDC, and the technical head, and the ED, Primary Healthcare Development Agency, to elaborate on measures Nigerians will be taking subsequently, let me use this opportunity to wish our Muslim brothers and sisters a happy Eid al-Fitr. May the Almighty answer all our prayers during the Ramadan. I thank you for listening and have a good evening.
Good afternoon, everybody. The Chair of the Presidential Steering Committee on COVID-19, honorable ministers here present, permanent secretaries, directors general and executive directors of government agencies, members of the press, WHO country representative, and representatives of ministers, ladies and gentlemen. As at this morning, 165,419 COVID-19 cases have been confirmed in Nigeria out of 1,977,479 samples tested, with 156,297 successfully treated and discharged, having sadly suffered fatality of 2,065 so far in 36 states and the Federal Capital Territory. As you can see, we are inching close to the 2 million mark of tests we had promised, even though it came well behind schedule. Just 37 new cases were diagnosed yesterday, the 9th of May, 2021. The case fatality rate has reduced since the beginning of this month, but should not at all be a reason to slow down. We should rather increase our commitment to reducing the spread of this disease as well as the fatalities therefrom. Although COVID-19 positive cases have continued to drop even with sustained testing, we must remain on our guard. The experience of other countries shows the unpredictability of COVID-19, such that countries in Asia, such as India, Pakistan, Thailand, have been badly shaken by the enormity of the new wave of infections they have suffered in the recent weeks. We continue to send our thoughts and prayers to our friends in India and to our Indian government and the people of India. And we take this opportunity also to renew our own caution in the COVID-19 pandemic response. Nigeria and India have similar demographics, and the COVID-19 trends so far have been quite similar. Therefore, we must take good heed of this forecast. The lessons to be learned are quite simple. We have said them many, many times. Avoid crowds and mass gatherings for whatever reason, whether for politics, religious, commercial, or social occasions. Wear your mask at all times when you are outside your house. Do not accept to chat or do business with anyone who is not wearing a mask. Do not buy from a trader who is selling without a mask. Wash or sanitize your hands frequently, and cover your mouth when sneezing and coughing. These are very simple measures. And finally, take your vaccination when you are invited to do so without hesitation. These, I have read out, are our best chances of escaping COVID-19 infection if we come in contact by mistake with an infected person. Nigeria participated last weekend in a high-level emergency virtual meeting of African ministers of health on the COVID-19 situation in Africa to review the impact of this pandemic in Africa and evaluate its implementation of the joint continental strategy 1 year after it was set up. The understanding is that Africa should be on its guard and that the cheapest and easiest prevention to survive any other wave is by strict adherence to the non-pharmaceutical measures, not necessarily to the vaccine effort. A roundtable discussion on the impact of COVID-19 on immunization programs and the need for African Medicine Agency set a common understanding among African countries for the emergency use authorization of medicines and vaccines among African countries. African countries also discussed the possibility and the option of joining hands to produce the COVID-19 vaccine on our continent. The leadership of the continent and partners renewed commitments to implement public health and social measures in the control of the pandemic as the best possible way to mitigate the impact, especially with the threat of the third wave, while also keeping control of other disease control efforts in our continent. We shall therefore in Nigeria continue to strengthen our preparedness, and I urge all members of the press to support our effort in that, especially in communicating to citizens as it relates to the point of entry and our case management centers to coordinate all the response pillars and other agencies in the health sector in preparation for any surge as is being experienced in other countries. We are stockpiling PPEs, laboratory reagents, and other commodities, placing order for drugs. We are embarking on staff training. We are repairing oxygen plants that are not functioning all over the country. We have completed plans to build new oxygen plants, and we are examining our logistics for oxygen and commodity supply chain. And we're also planning and placing order for more oxygen cylinders of various sizes from abroad. Ladies and gentlemen, as we approach these Salah holidays, it is of particular importance for us all to remain aware of the risks involved in traveling, in socializing, and in letting down our guards. I urge everyone to take responsibility for their own personal and their family safety from COVID-19 infection. I've just mentioned the experience of India and other countries, which shows us that this terrible third wave was spiked that has caused so much loss of human lives, was spiked and facilitated and fueled by events that immediately were related to political campaign and election and gathering for religious celebration. This contributed greatly to the explosion of cases at a time when India thought that they were out of the woods and when they thought that they were safe, and they are today still battling with the consequences. As we ourselves celebrate these days, Salah days coming ahead, let us remember this warning and ensure that we avoid all situations that tempt us to forget that there's a danger in COVID-19 and that we must respect the preventive measures and the life-saving non-pharmaceutical interventions. Above all, let us keep the elderly and vulnerable populations safe by encouraging them to stay indoors and avoid crowded places, to wear masks, ensure physical distancing, and observe appropriate hand hygiene. This advice is also good for everyone else. I wish you all Ramadan Kareem, and may the Almighty God grant us happy Salah holiday. Thank you.
So, Chair of the Presidential Task Force, honorable ministers, colleagues on the Presidential Steering Committee of the Task Force. Good evening, gentlemen of the press. My comments will be very brief this evening. As you can feel from the mood of the Presidential Steering Committee, this press briefing and everything you hear today really is driven out of a heightened sense of awareness of what is going on in India, in many other countries in the world, and also in realization of an increased level of complacency in Nigeria on what we need to do. Yes, our numbers are low. We're happy with that. But we also realize that this has also led to many of us dropping our guards. So today I really wanted to speak on three issues. The risk that we're facing, how do we think about it? There are three ways to think about this. One is related to the virus. Secondly, it's related to the vaccine coverage. And thirdly, to how we ourselves, the population, is implementing public health measures to mitigate some of those risks. Firstly, in terms of the virus is changing. The more it is transmitted, the more it develops new mutations, the more it develops the capacity to move from one individual to the other. And it is in these mutations and these changes that new variants emerge. And those variants have led to really the most rapid escalation of cases we have seen in any country happen in India. Literally, over a few weeks, We saw the steepest rise. If you look at the curves in every other country, no other country has a rise as steep as what we saw in India. What that tells us is if we are to face a situation like that, we will not have the time to prepare. So we have to use the opportunity the virus gives us now to prepare, while trying to prevent it, obviously, but also to prepare. But to do that, we have to understand what happens within the virus. How do we do that? We do that by consistently testing people. I'm very grateful for the work being done across the country. We have sustained our testing efforts to 30 to 40,000 tests per week. We're now at the 2 million mark, a little bit later than we anticipated, but still good progress that we've been able to maintain this over the last few months. So yes, our testing has continued. But the other aspect of it is, once you have a positive, the next bit of technology is to identify that variant. You can only do it through a technique called sequencing. We've now sequenced about 700 across the country. Not enough, but a fair bit, given how complex it is to do that. And I really want to thank our colleagues at the Africa Center for Excellence in Genomics in EDA, who have been supporting the country with this very important capacity. So Professor Happy and your colleagues in EDA, thank you very much for the work you've done for the country. We have continued to do this, scale our capacity, and that will be the focus of our efforts in the next few weeks. So as we continue to understand the virus itself, we will understand what we need to do about the virus. The second bit, which I won't spend too much time on, because my brother, the ED of MPACD, will elaborate in detail on the excellent work they've done in raising the vaccine coverage in Nigeria, using up as many of the vaccines that we have, really educating Nigerians on the problems that we've been facing, and some of them from very prominent members of society, unfortunately. Really contradicting the efforts, the very difficult efforts, very sustained efforts we've made to raise vaccine acceptance in the country. And we've been very happy with the results that we've received across the country. Most of the vaccines that we have available have now been given. But we have to sustain these efforts as we advocate for more supplies, both locally, but also make the case globally on the complete unacceptability of the current situation where, in a continent as large as ours, we simply don't have the vaccines to immunize our people. So the Minister of Health, the Minister of State, all our colleagues, the ED, MPACD, have spent a lot of their time advocating to the global community, to countries, discussing in bilateral terms, in multilateral terms, in order to gain more access to the vaccines, in order to then make it more accessible to our people. So that's the second part, in terms of how do we raise the community immunization levels in our country, so that even when there are introductions, we have a fairly substantively protected population. So in these two areas, vaccines and viruses, you might argue, okay, viruses, you can't do too much about it. The vaccines, government has to do a lot of work in enabling supply. But the third area really is where Nigerians can do so much about. It is really understanding the risks that we face and what you can do about it. The risk with this virus, you have to really think about the curve in India. It's not something that goes from one to the other in a gradual pattern. A single big super spreader event can lead to one individual transmitting it literally to thousands. So you have to really think, everybody that is going to a wedding, a political campaign, a church gathering with thousands of people, especially when these are indoors, has to really think about the consequences of those actions. So how do we ourselves, when we go out, especially into gatherings where there are many people, because that is really where the risks happen. If you look at, by the time we complete the analysis of what went on in India, it is very likely that we will find that certain gatherings linked to religion, certain gatherings linked to politics, is most likely to have instigated the spread of infection in that country. Religious events, political events, they are no strangers to us in Nigeria. This is what we do. We're going into a political season soon. We're going to religious festivals soon. So we have to be aware of those risks to us, because we don't want to get back to where we were a few weeks ago. So if we think about the risks that we face in these three areas, around the vaccine, around the virus, around the vaccine, and around our behavior, we might be better prepared to do what we need to do as a country to mitigate all of that. So please, Nigerians, keep working with us. We will keep pushing. We're working very hard on prevention. The federal government has taken some very hard decisions in limiting travel to countries, three important countries, but for the short term, health has really taken the priority in limiting our travel to these countries. So we have done what we need to do in terms of trying to prevent. The next thing is mitigating this if it comes in. But we need everyone on board. We need your support. We need everybody to work together so that we can keep the small gains that we've made over the last few months working together. So on that note, I'll end by wishing all our Muslim brothers a good end of Ramadan in a few days' time, and look forward to continuing working with all Nigerians as we work very hard to keep the country safe. Thank you very much.
The Chairman of the Presidential Task Force, Honorable Ministers, colleagues, distinguished ladies and gentlemen, good evening, and I welcome you once again to the Presidential Steering Committee update on COVID-19 vaccination in Nigeria. As I mentioned during our last briefing, the COVID-19 vaccination in Nigeria is ongoing as scheduled in all states. As of today, May 10th, 2021, 1,690,719 people have been vaccinated, representing 84% of the eligible persons targeted with the Oxford AstraZeneca vaccine. These people have been administered their first dose in this vaccination phase. These are the most up-to-date figures we have received from our daily calling data from the states. We want to take a moment to publicly thank our teams across the states for the excellent work they are doing administering the vaccines. We are making great progress administering safe, effective vaccines to people all over our country. We'd also like to state our appreciation to Nigerian citizens for the cooperation they are providing to our vaccination teams across the country. We are continuing to optimize our registration and immunization data systems to maximize the efficiency of this system. The need to protect ourselves and put COVID-19 behind us, the way we have done for polio eradication, so that we can return to our normal living, is truly a national effort. In addition to health workers, frontline workers aged 18 years and above and persons aged 50 years and above are advised to visit any designated vaccination sites to receive the vaccine free of charge. We also advise that people who have received their first dose should check their vaccination cards for the date of their second dose and ensure that they receive the second dose to gain full protection against COVID-19. I want to remind you that the eligibility period for the first and second doses of the vaccine have been expanded from 12 weeks to between 6 to 12 weeks, in line with the scientific recommendation provided by the World Health Organization's Strategic Advisory Group of Experts, the SAGE, on immunization. Already, the Presidential Steering Committee has approved the commencement of the second dose vaccination of the Oxford AstraZeneca vaccine in all states of the Federation, including the FCT. In both technical and operational terms, the committee has been very supportive of the states. We have redeployed senior supervisors to the states and have continued to monitor activities in the states with daily evening review meetings with supervisors in the states to determine the status of the COVID-19 vaccine implementation in all states and the FCT. These meetings, as I had mentioned during our last briefing, allow us to receive reports from the subnational level on how the campaigns are proceeding, what challenges they face, and how we can proactively anticipate and resolve any impending challenges. The meetings also provide an avenue to troubleshoot and resolve any operational hurdles as they emerge before they become problematic. As we did during the polio eradication fight, we are strengthening our COVID-19 vaccination campaign at community level with the town hall meetings across the country. Already, we held the North Central Zonal Town Hall meeting 2 weeks ago in Lafia, the capital of Nasarawa State. In the weeks ahead, we hope to continue the dialogue in other geopolitical zones of the country. The town hall meetings afford the communities the opportunity to directly participate in the dialogue with the government as we work to protect the people against the pandemic. We know that many people are very concerned about the health threats posed by COVID-19, but also the economic threats. The town hall meetings allow us for views and concerns to be heard as we work together to move beyond COVID-19 as a nation. Let me end by imploring Nigerians to continue to cooperate with our vaccination teams who are providing an incredibly important service to our nation amid this global crisis. The government will ensure that only safe and efficacious vaccines are supplied for all phases of the vaccination campaign in the country. To our Muslim brothers and sisters, I say Ramadan Kareem and Happy Salah in advance. Thank you for your time and attention. God bless you, and God bless Nigeria.
By restricting travel from 3 countries, Brazil, India, and Turkey, where there is an observed high incidence of cases, high fatality rate, and widespread prevalence of variants of concern. The PSC continues to reinforce the surveillance system at the country's points of entry. While our vaccine rollout has begun, there is a shortage in global supplies affected by the current situation in India. This translates to a delay in vaccinating a large proportion of the population, and therefore a risk of a large outbreak, especially in the context of poor adherence to the recommended public health and social measures. There are strong concerns about the non-compliance to public health and social measures, which are contained in the Health Protection Regulation 2021, specifically the level of adherence to the use of face mask, physical distancing, temperature checks in public spaces, hand washing, and limitations placed on large gatherings remain very poor. In some areas, these are even non-existent. In line with the increasing risk of a surge in cases, the PSC is therefore maintaining the enforcement of the COVID-19 Health Protection Regulation. This is to mitigate the risk of a spike in new cases while the nationwide vaccine rollout continues. The national response continues to focus on achieving a balance between preserving lives and livelihoods while working towards long-term epidemic control. Further to this recommendation, and effective from 0001 hours of Tuesday, 11th May 2021, this phase 4 of the first restriction of movement shall come into effect. We shall maintain restrictions on mass gatherings outside work settings with a maximum number of 50 people in any enclosed space. Approved gatherings must be held with physical distancing measures and other non-pharmaceutical interventions in place. Enforcement of mandatory requirement of a 7-day quarantine for all international passengers arriving from foreign destinations, while institutional quarantine for international passengers arriving from the 3 countries we mentioned. Enforce temperature checks and no mask, no entry policy in all public settings, workplace buildings, businesses, places of worship, etc. Access to government and commercial premises should be denied to any person not wearing face mask. We'll continue to maintain restriction on the resumption of work of government staff workers from GL level 12 and below. We'll also limit government meetings to virtual platforms as much as possible while maintaining restrictions on physical meetings, including official trips, oversight visits, and board meetings. Event centers, bars, nightclubs shall remain closed until further notice. Restaurants are to provide eat-in at 50% capacity and provide takeaways where available. These measures are to enable the government of Nigeria effectively prevent and control the resurgence of an acute phase of this pandemic, continue to strengthen our public health systems, and protect the lives of Nigerians and our economy. It is critical that greater ownership and responsibility of these measures are secured from both the general public and government institutions across federal and state levels. It is believed that these steps will help consolidate the gains made thus far and position our country to effectively overcome the pandemic going forward. The Presidential Steering Committee has made these recommendations in line with the established thematic areas of movement, industry, labor, and community activities. The nationwide curfew will be imposed tonight at midnight, and it will run through till 4 a.m. No formal restrictions on movement within the country, given the risk that citizens are encouraged to refrain from non-essential movement and comply with NPIs and guidelines. People who are aged 60 years and above or with comorbidities are strongly urged to stay at home and avoid crowds. We have advised Nigerians on essential travels, international travels. Only essential travels are encouraged, and both international and domestic travelers must abide by all existing protocols. All arriving international passengers must register with the Nigeria International Travel Portal. Rail transport, no limitations to interstate or intrastate travel. However, consumers of services must ensure that they abide by stipulated regulations. Security agencies are to enforce the use of non-pharmaceutical interventions in the transport sector, and also which include use of face mask, temperature checks, and use of hand sanitizers. In terms of working arrangement, virtual meetings are encouraged to take place as much as possible. We should avoid large meetings, decongest offices, and ensure that they are well ventilated. States have been asked to institute mobile courts to help enforce on-the-spot fines and close premises that violate these provisions. On communal services, markets, and stores, they should ensure that there are spot checks of commercial premises and observe all mandatory non-pharmaceutical interventions. Facility owners and managers and store owners are to ensure that physical distancing is observed. All mass gatherings remain restricted to 50 persons, except where explicit permission has been granted by the state governments. Hotels are to remain open, but they must observe all non-pharmaceutical interventions. Schools have already reopened. However, they should consider the use of approved antigen-based rapid diagnostic tests as recommended in the guidance by NCDC. All religious gatherings should be limited to less than 50% capacity to ensure physical distancing, and use of face mask is mandatory. Recreational facilities, all recreational venues, gyms, and indoor sports facilities are to close until 11th of June, when the situation will be reviewed. However, non-contact outdoor sports, such as golf, polo, tennis, are not affected by this. Gatherings in weddings, parties, and meetings should also comply with the 50%, 50 persons, not more than 50 persons provided. Mass political gatherings involving large number of people are strictly to adhere to the COVID-19 protocol as issued by INEC. Violations of these protocols, each state government to set up mobile tribunal for prosecution of violators, and security agents are empowered to make arrests for violations under the Health Protection Regulation. These safety protocols only provide a baseline from which state governments may further build on to strengthen their responses based on their local circumstances. States should continue to consider them as minimum guidelines required to ensure an acceptable level of epidemic control. Lastly, as we prepare to commence the end of Ramadan festivities and Salah celebrations, we urge Nigerians to be cautious, to avoid crowded places, and ensure that they continue to use face masks and also social distancing where necessary. Thank you, and God bless.
We thank you immensely, the head of Technical Secretariat, Dr. Mukhtar Mohammed.
Themselves on their feet. With the outbreak of COVID-19, all countries were looking forward to vaccine, including Nigeria. And in our own hope, believing that it is possible to easily find a partner to import the technology to produce our own vaccines here, the National Assembly earmarked 10 billion for that production of vaccine. Now, I will assure you that that 10 billion is safe. It has not been touched. Not one penny has been taken out of it. But it has not proved so easy to import that technology to start producing COVID-19 vaccine. And therefore, the aspiration to produce that vaccine has not been fulfilled. But it's not that it's abandoned. We're working on it. COVID-19, I spoke with one of the members of the Board of Management. They're working on getting that technology to both produce routine vaccines and also COVID-19 vaccines under license by importation of the technology and partnership for it. So the Serum Institute of India, with which we are going to partner, probably presently has a lot of its own challenges taking care of the problems in their own country. So that's why that situation is still where it is. We are hoping that there will be more partners or other partners who will join with COVID-19, with biovaccine to get that project on its feet. There is great interest now in this continent having a COVID-19 vaccine producing facility. And Nigeria is also interested in that, and they're trying to see what we can do to ginger biovaccine up. We are going to have a meeting with them soon to ask what can we do to help to get this company on its feet and running, and then probably get support from outside investors, get technology from outside to meet this objective. There's no one who doubts that COVID will be in the world for a long time. So sooner or later, we have to be producing vaccine, because the vaccine nationalism that you spoke of means that others take care of themselves before they take care of others. So therefore, we have to get on our feet to take care of ourselves, and that situation will be further advanced when we've had a meeting with COVID-19, with biovaccine, I keep calling them that, biovaccine company, when they give us their plan and work out on how to accelerate their plans and put them on their feet. Thank you.
Rachel, thank you. A very impressive knowledge of geography in Nigeria. In the state I come from, nowhere is more than 2 hours apart. So, but it's a very important question, actually. So what we're doing really right now is, in addition to the acute responses which we update here every day, is really developing our surveillance architecture across the country. And these are siloed in different ways in human capacity, training, disease surveillance notification officers, DSNOs, in every local government. So we have an integrated training of surveillance officers that is going on at the moment in one of the zones. We're taking it to each zone. So whether it's in terms of reagents, human resource training, labs, really quietly we're trying to change the whole landscape for health security, because that's what is required in the long term to keep Nigeria safe. But some of these things are also around innovation. So the rapid diagnostic test kits, now we're hoping to get those are easy to use, really to get them to the front lines across the state. So wherever you are, you can at least use the RDT, make that diagnosis, and if you have any reason to send it to a central lab, you do that. And many states are now taking this whole business very seriously. States are investing themselves. The governor of Enugu State has just called me. He's built up a lab himself, asking us for support, just in advice on what to buy, how to develop that infrastructure. So I think working together with the state governments, everybody is now acutely aware of the risks that they face. Well, not everyone, but many more states are on the risks that they face and why it is important to invest in this. And so whether they're 1 hour about 7 hours, our responsibility is to really build this up across the country. And then I think Mitari asked about the B1351 variant in South Africa. I know we're journalists, but we have to be very careful with our use of words. Yes, it's been detected in a few countries, but I won't really use the term of spreading fast. It has been detected in a few countries, especially in countries around Southern Africa, so the countries around South Africa. This variant, the peculiarity why it is a vaccine of concern is because it escapes vaccination, or one study saw that there was some impact on vaccination in in that particular study. Subsequent analysis doesn't seem to really come to the same conclusion, but it's still being classified as a variant of concern. Our role is twofold. Firstly, to detect it as much as possible, and that's what I said by increasing our sequencing capacity. But ultimately, what we need to do here is to continue pushing our vaccination efforts so that even before it has the opportunity of getting into Nigeria, that we are able to reach a high level of population immunity in our country. So that's what we're working on collectively. And by doing all of this, I'm sure we'll get on top of it. The challenge we all have is not to drop the ball, not to get complacent. Whether it's on the side of government, you can see we're still here briefing the press every other week. We're also tired, but we have made that commitment not to drop the ball, to keep at it, even if there's a certain element of fatigue setting in. So we're also challenging everyone to do your own bit. Don't be fatigued, do what you can, whether you're working at the state level, whether you're leading a community of people, wherever you are, do your own bit, and together we'll be able to hold down the gains that we've made. Thank you.
Okay, thank you for those questions. So Rachel, you asked whether the vaccination is going to be mandatory for all Nigerians. We are advising eligible Nigerians to take the vaccines because that is a sure way to protect yourself from COVID-19 virus. We know that there's vaccine hesitancy. It is here in Nigeria just as it is present globally. So it is not something that is local to Nigeria. What we have to do is exactly what is done everywhere else globally, to make sure that we put the correct information in front of all Nigerians, that we continue to advocate, we continue to communicate very clearly, providing the correct information as to why and how the vaccines work, so that Nigerians have a clear understanding. It is our responsibility as scientists to put that information out there. We understand that it's not everybody who understands the science of vaccines. So if people speak contrary or campaign against vaccines, it is because they probably do not understand the science behind the vaccines, and that is exactly what we see everywhere in the world. So as a presidential steering committee, as the Federal Ministry of Health and the agencies under the Federal Ministry of Health will continue to work to make sure that we educate all Nigerians. We believe that Nigerians are rational, that if they get the correct information, they will make the right decisions, irrespective of the conspiracy theories that are out there in social media or wherever those may be. You asked about the numbers of side effects. So the number of side effects have not significantly grown beyond the numbers reported the last time. That is why I did not include them in my report. Still way under 9,000 mild cases of side effects following, adverse events following immunizations. Then in terms of severe cases, so one of the greatest challenges that we face is that linking the vaccines and the so-called severe effects in terms of cause and effect. In a number of cases, people actually get the vaccine but fall ill from completely different causes. What the vaccine does is to protect you from COVID-19. It doesn't protect you from malaria. It doesn't protect you from any other condition. So you can continue to be sick from others. So making that link is always very, very critical. And once people have adverse events following immunization, then they should go to the nearest health facility to get treated if it is severe. For most mild cases, usually people are able to overcome them within 48 hours. Thank you very much.
Thank you, Executive Director, National Primary Healthcare Development Agency, for that explanation. Well, sir, I heard one of my colleagues talk about the geography of Nigeria, and Adamawa State was mentioned, Yola to Gembu. I saw you shook your head about 8 hours from Yola to Gembu. Talk about that distance.
Yeah. Okay. I don't know when last you went to Gembu anyway. But on an average, from Yola to Gembu now will take you at least not less than 24 hours. Well, in those days, we used to do it in 2 days, 3 days. Because you start from Yola, you break it somewhere around Sati, which is in Gashaka local government, spend the night there. Then depending on the weather condition, you can go up the hill in a day or two. It was a frequent route that I followed when I was still in active practice and also as a politician when I formed the then PSP and the Social Democratic Party when I became the pioneer chairman of that party in the then Gongola state. So it's been a long time that I've been there too. But a beautiful place, honestly a beautiful place that Nigeria can convert into a first-class tourist attraction. And hopefully by the time the Mambila Plateau hydro power station comes on board, the whole place will be open. And that's the home of the beautiful Highland tea. It's a natural place. In those days, I did some little business too. I exported. I did tea business. I was a tea merchant, and I was also a coffee merchant. So, I mean, I've tested all things. But back to the question, it will take you at least not less than, you can start it, how many hours? 12 hours now from Yola. You can start and get onto the Mambila Plateau in 12 hours. Okay, so the road has improved. In those days, we used to do it in 2 days. 2 days to be able to travel. Yeah, but I think the essence of your question is how have we covered the entire nation in terms of vaccination and also testing. But I think we've done quite a lot in that area. And I believe that with the full cooperation and support of the subnational entities, a lot of them moved, particularly the vaccination administration, to the local government areas. And in that process, at least, every part of the state must have been tested. How do I know? Because the district head in my community got his vaccines in his palace in the local village. So I believe that there has been a widespread administration of the vaccine. The objective is to try to vaccinate at least 70% of our population between 2021 and 2022. And that's a target that we must work assiduously to be able to achieve. Achieving that is very, very important so that at least through that process we can get to herd immunity and get our people protected. But now back to some of the questions that were directed at me. Madam Son, you spoke about the persons who absconded from facility in Lagos. Yes, they did. You remember when we briefed the nation through you on the 26th, we had course to outline a new travel protocol for people coming in from Brazil, India, and Turkey. And part of that protocol is that they will go into mandatory quarantine in a government-identified facility. Some passengers came in. They reported at the identified facility, but later somehow absconded. That is being investigated by the Lagos State government, which is pretending over those facilities that were provided. We don't want to come to conclusions or await the outcome of those investigations before we act. But I can tell you that such actions would come with their punitive measures and the people would bear the consequences of their actions. If we can treat Nigerians in the manner we had to deal with people who came in and did not turn up for the post-arrival tests we will not shy away from taking very effective measures to ensure that we protect our nation and we protect our people. This is a very critical moment in our response. So far, God has been very gracious and helpful to our country, and we've been able to tame the very virulent nature of the virus in terms of infection, spread, and we will not allow any act of rascality from anybody jeopardize what we have been able to achieve. Rachel, okay, this is the issue of whether there will be punishment for people who refuse to take the second dose. Vaccine administration is not a it's not driven by compulsion. It's an act of persuasion that we have tried, and that has been our message and our language all through the course of the national response. We've tried as much as possible to persuade people because it is an issue of public health, and we believe strongly that people should be very considerate in not running away from or being hesitant in taking these vaccines because it is intended to protect our people and our communities. And whatever conspiracy theories are being bandied out there, it does not stop the spread of COVID-19. It further just complicates our work, and it's a major distraction. And I believe that as responsible countrymen and women, we will do what is needful in encouraging people to take the vaccine. If because for whatever reason I am in a position to protect myself, but I should look at the overall interests, the common good and interests of the people that would not be able to accord themselves the necessary protection. And whatever I do, whatever I say, should be born out of the interests and the preservation of lives and livelihoods, particularly that of lives. We've recorded, unfortunately, over 2,000 deaths in the midst of this pandemic. That is a number some countries record in a day. India, where we received the first allocation of the COVAX vaccines, they have the biggest manufacturing facility for vaccines in the entire world. But today, they are being confronted with a cycle of very extensive and intense transmission in their communities. Over 400,000 in almost 2 weeks consecutively every day, with a death toll of between 3,000 and 4,000. And as a matter of fact, the projection is that very soon they would, if the situation does not abate, their death toll will get to 1 million, even over and above what the United States has battled with in the last couple of months. So it's a very, very difficult situation for a very friendly country like India. As a matter of fact, the first gift of 100,000 doses of AstraZeneca vaccines we got was from India. And it wasn't only Nigeria that received that donation. They were willing to give all over the world. But because of the circumstances of their nation today, even what has been paid for cannot be delivered. Because some people paid for the COVAX facility we were benefiting from, but it cannot be delivered because they have to now redirect their energies and their supplies to meet their local population. If they want to vaccinate about 70% of their population, I stand to be corrected, but it means that they would have to vaccinate about 930 million Indians before they start thinking about exporting vaccines out of their country. That has put a lot of pressure on us. And that was why we had to strategically decide on who would get the vaccine next. From the first phase, we've decided we'll vaccinate everybody using the about 4 million that we got from the COVAX facility, in addition to what we received from the Indian government by way of donation. So our hearts go out there for the Indian people and the nation and the government, because they have shown and demonstrated goodwill towards the people of Nigeria. And in this moment of serious grief in their nation, we just continue to pray for them and their nation, and trust that they will put in place effective processes that would abet the further spread and the catastrophic effect of the COVID-19 upon their nation. Gloria, you did ask about the $50 test fee that has been imposed by the heads of governments and authorities of states and government of ECOWAS nation. That was a decision they took some few weeks ago, all in an attempt to reduce the cost of testing within the West African sub-region. That is designed for travels only within the West African sub-region, not for travels out of the West African sub-region. They felt that for whatever kind of test that is demanded by different nations, some demand for PCR, some demand for the antigen test, the fees were not the same across board. So as authority of the heads of state and government of West African sub-region, the ECOWAS, they decided to peg it at $50, but only restricted to travels within the West African sub-region. And the only people qualified for that is if you carry an ECOWAS passport. If you look at your Nigerian passport, you will see that it is also an ECOWAS passport, in addition to being a Nigerian passport. So if you hold that passport, or you hold a traveling certificate that depicts that you are a member of the ECOWAS, you would have the benefit of that. My only appeal is that the private labs that do the testing for travel purposes should take this notice, because we've given, if you see in my address, I did mention the fact that ours in Nigeria will be effective from the 17th of May. So it's not taking effect from tonight, so that they can put in place all the processes that are required to ensure that they are able to segregate the two tests. Tests for travel elsewhere is different for tests within the ECOWAS sub-region. So the other cost element that we have all bore for anybody that has traveled out of the country in the last couple of months would continue. But now for tests within the West African sub-region, the ceiling has been put at $50. But I think the most fundamental thing that I would want to leave with you, through you, to the nation, is that we are going into the feast of El Fitr, which is the celebration of that comes at the end of the Ramadan season. My appeal to Nigerians is that let's celebrate with caution, with a lot of caution. We are not out of the woods yet. COVID-19 is still very virulent, it's very real. And if experiences of other jurisdictions is anything to go by, it is a clear indication that at the time you think you are out of the woods, that is when you can have a very, very serious reversal of everything that you've done in the last couple of months. And that always comes with a lot of consequences. in terms of number of infections and in terms of fatalities. So my sincere appeal to the people of this country is that we have to be very careful. Let's still adhere to the non-pharmaceutical interventions. I had a debate, I saw a debate and some kind of a news analysis on the CNN as to why does the American president still wear a mask after having vaccinated fully about 150 million Americans, and partially almost 200 million Americans have received one form of jab or the other. But fully about 150 million have been vaccinated with their 2 doses or 1, depending on the variety of vaccine. Why do they still wear masks? The fact of the matter is that they have not gotten to the point of the herd immunity. And 2, vaccination is just a form of enhancement of your, what I would call ability to withstand even if you get infected, so that you do not fall terribly sick. So there's still a lot that we don't know about this virus, about its mutation. We are now, when we started, we were talking about one variant of the virus. Now we are talking about, you are categorizing, and they keep multiplying in number. So unless the whole story is known and the effect of the virus in different forms and mutations are known, we continue to adhere to the non-pharmaceutical interventions, which is the wearing of masks, the keeping of social distancing, and keeping your hands clean by washing and sanitizing, and also avoid mass gatherings. If it is not necessary, please, all these festivities and celebrations, we will get to do them for those, I mean, for anybody that God grants him an extension of life, and we will get to celebrate all these days and festivities in the future. So my appeal is that, as much as possible, let's celebrate with caution. Gone are the days, I have seen it, and I do not want to see the resurgence of any form of recklessness on our part as a nation. We've done well in really taming this virus and turning the curve. We should not do anything that would impair that would jeopardize what we've been able to achieve all this. With these very few remarks, I wish you Barakah da Sallah, and like I said, let's celebrate with caution. I'll see you after the festivities. Thank you.
Thank you very much. The Chairman, Presidential Steering Committee on